Veneers on the airwaves. Kabayan Radio continues to bring you closer to the music you love.
I need somebody who can love me.
To the entertainment you love.
To the information you need.
And to radio advertising you deserve.
Over analog
And multi-digital platforms.
This is Kabayan Radio,
94.3 FM.
the first and the only
Filipino radio station in Qatar. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in. Right here on Kabayan Radio 94.3.
A wonderful Tuesday evening. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. My name is Kenzo.
And of course, my name is Andi, and welcome to another episode of The Doctor is in, mga kabayan.
And yes, right now, partner, in addition to broadcasting this program on the airwaves, we are also simultaneously streaming live on our Facebook page.
Of course, partner. And they could also watch us by heading on to @Kabayan943 for our Facebook Live. And syempre, meron tayong YouTube account, meron tayong YouTube channel. So, and partner, this program is also made possible by our partner, the Gulf Dental Center.
But before we introduce our guest partner for tonight, I would just like to quote Mother Teresa. And sinabi niya that let us always meet each other with smile. For the smile is the beginning of love.
I
Ang
definitely
ganda, diba?
agree. Ang ganda.
Smile is the beginning of love. So for my question to you who is listening or watching us right now, how confident are you with your smile? So tonight we'll be discussing about oral health, how to take care of our teeth, dental veneers, and many more.
That's right, partner. And joining us here in the studio, mga kabayan, is a dentist from Gulf Dental Center, of course, and he graduated from the University of the Philippines in 2016 and received his license in the same year. He attended several trainings in preceptorship for aesthetic, dentistry, and orthodontics, mga kabayan, which he later on transferred to Doha and has been working with Gulf Dental Center as a general practitioner. And right here, mga kabayan, with us is Dr. Arman Miguel Yuson. Good evening, Doc. Kumusta ka po?
Good. How are you guys?
Thank you for joining us
Yeah.
here in the studio.
For sure, very busy sila ngayon, no? Siguro may mga nagpre-prepare din for the World Cup. So,
Papaganda.
oo, may mga ganyan.
Sa bagay, ano?
Di ba? Kasi wala nang time.
Oo,
Magkaka-traffic.
ang daming happening.
May
Yes.
mga ganun ba mga immediate talaga ng mga patients niya pumupunta?
For sure, tough. But yeah, we have dental emergencies and stuff. Yeah.
Yes, okay.
And siguro in preparation na rin before, you know, the FIFA season comes in, syempre kailangan
right.
ng gawin yung mga pwedeng gawin as early
Yes,
as
kasi
now.
on top of the traffic that we are surely to experience, syempre mas okay din yung mas earlier pa sa
Right.
time na dapat nilang puntaan.
Right. Pero Doc, just to start off this conversation about oral health,
Yeah.
what is the main reason on why we should be taking care of our oral health?
Well, obviously, our oral health is very important since our mouth is the gateway for us to absorb nutrients, how we eat. So if you have bad teeth, you can't chew your food properly. You're very limited to the options of your food. Like you can't, if you can't chew, you can't eat meat, or you can't, you're just limited to soft diet. So, and also if you're experiencing pain, you won't be able to eat, you won't be able to sleep, you won't be able to work. So I guess that would explain how important our oral health is. And also it's, we can consider it as how it affects our mental health. Because, if you're not that confident with your smile, you can't smile, it would affect your confidence as well. So, yeah.
Pero paano po natin ito ginagawa? No? How do we properly maintain our oral health?
Well, apart from just, doing the proper oral hygiene, which is brushing your teeth twice a day, flossing, it's also very important to visit your dentist at least twice a year.
Twice.
Yeah, twice a year. Every 6 months, that's just the minimum. But if you have some other concerns, like if you're experiencing pain, you don't have to wait for the 6 months before you visit your dentist. Yeah.
Pero yung sa 6 months na gap ng visits, usually when we go to a dentist, what should we expect?
Well, first we do, X-ray to do a diagnosis to see if there are certain problems that needs to be done, and then we do oral examination. So we check each teeth and then your gums. We check the health of your gums. So basically, we just check everything, and then we ask how your everyday life is with your,
Di ba, partner, na pag-uusapan din yung pag-maintain ng ating oral health and doc, and of course kung ano ba yung dapat gawin. So very curious lang din akong malaman na how can we save money while we are maintaining proper oral health ba?
Actually, for that one, kasi our main problem is, the neglect of people,
Yes.
We tend to neglect our oral health, so people just usually go if they're experiencing pain already, or if there's some, black.
Actually, yun yung nangyayari talaga. Yung napapansin ko, kung meron ng masakit doon na pumupunta.
There's already black decay in front of the teeth. They can't smile anymore. That's the only time that they would go to the dentist. But for that case already, then it tends to be the worst stage already of the disease. So if you go regularly and you don't have any pain, you don't have any of those, you'll just do the proper cleaning, just maintaining the filling. But if you already have the pain, the infection, so that the treatment for that one, you'd go for root canal, you'd go for bridges, you'd go for implants. So that would cost a lot more.
Mapapagastos ka pa.
Yung iba kasi iniisip nila, tsaka na ako magpapadentist, tsaka na ako magpapalinis.
Kaya nga talagang
Mas napapamahal,
Yes, oo.
And the thing is, people, there's new iPhone that comes out, then they buy it, but then when you look at their teeth, they have bad teeth. So you could see the priority, di ba?
But isa sa mga isa sa mga gustong-gusto ng mga Pilipino talaga, yung may magandang ngiti. And usually they can't wait minsan yung pagpalagay ng brace para medyo matagal. Yung iba nag-opt into having like veneers or yung tinatawag natin
Dental
na
veneers,
Hollywood
mga
smile.
Hollywood
Can you
smile.
further explain ano po ang ibig sabihin ng veneers?
So veneers is direct or indirect restoration that we put on top of the teeth. So it's more conservative as compared to the crowns, because crowns are full coverage. So we prepare until also the back of the tooth. But veneers is just on top, in front. So veneers, you can change the shape, we can change the color, we can change the alignment. So if you want to change the profile of your smile, that's why...
Pwede, no?
Yeah.
Very possible.
Yeah, very possible. So usually you would see this on beauty queens, celebrities, yeah.
Mga anchors, yung mga newscaster. Hindi pwede ba kami
Pwede.
In-insert talaga yung sarili, no?
Baka naman sabihin natin sa Golf
Oo,
Dental.
baka naman Golf
Thank you,
Dental.
Golf Dental Center, for my veneers.
Pero diba,
Nagparinig.
before you suggest for veneers din, tinitingnan nyo din talaga yung ngipin, kung talaga bang kailangan o hindi.
Right.
It's not for everyone. So if your teeth have defects at the back, then the veneers would not be a good option for that, because veneers usually is just on top. So if you have defects at the back, then your veneers would be resting on a restoration, which wouldn't last as long as the veneers. So it would be better to have the veneers put on natural tooth so that it would last longer.
But usually, what are the considerations when you are assessing a patient? Kung pwede ba siyang mag-veneers or
Yes.
hindi?
Well, we check first of all the health of the teeth, if there's no decay and there's no infection or anything, and then we check the alignment. Because in veneers we can correct minor misalignments, but if it's really rotated or it's too much protruding, then the preparation for that one would be too much, and we would expose the nerve of the tooth, which is not a good thing. So so we check the alignment, and then also the needs of the patient, how they smile, what teeth are seen, things like that. Yeah.
Pero nabanggit niya din daw kanina that about the length of, the procedure itself. So usually when someone goes into your clinic para magpa-procedure, gaano katagal ang procedure na ito?
Well, we should expect that for the indirect type of veneers, the porcelain ones, it would take multiple appointments.
Oh, okay.
Yeah, so the first appointment would be just for the assessment. We would take a impression and then make a wax up and take photos as reference, and then we would create the profile for the smile. How are we gonna do it? And then the next appointment for that one is, which is the long appointment one. We do the tooth preparation, and then we take the final impression, and then do the temporaries. Because after we prepare the tooth, we have to put a temporary on top of it so that it wouldn't be sensitive, and it's also you can get used to the shape with the veneers on. So
Okay. And you've also mentioned about porcelain. What are the different types of veneers, and how do they differentiate from each other?
well, basically we usually do just the composite veneers, which is the direct type of veneers. We do it directly
Okay.
on the patient, and then the indirect type is the one that's the porcelain, which is we send it to the lab for the fabrication. Yeah, so it's usually multi-layered porcelain.
But what's their difference like?
Well, porcelain it lasts longer since the
Okay.
material is porcelain, and it's stain resistant, and the hardness is quite close to teeth. The composite one is the same as the filling, normal filling, but we just shape it as a veneer. But for that one, the disadvantage of the composite veneers is it would stain. And it's not as durable as the porcelain, and you would have to replace it from time to time.
Okay. Like how long? How many years? Would it
Yeah,
take?
well, same as the filling. The average lifespan is around 3 to 4 years. Could be longer or shorter depending on the patient.
How you
And porcelain veneers, according to studies, it can last for 10 to 15 years. Some say 20 years if you take care of it properly.
Wow.
Yeah.
Medyo mahaba din.
Kapag nag-veneers ba tayo, are we not allowed to drink yung mga talagang nagsistain, or pwede naman?
Pwede naman. Well, if it's porcelain, it would be a lot more stain resistant as compared to
So
the
yun yung isa sa mga difference
compared to the composite. But you still have to do your proper oral hygiene, and you still have to take care because
Hindi naman pwede, hindi ka na magtutoothbrush, di ba?
How about food? Kasi nasimulan mo na lang.
Yes,
How about
oo.
food? Are there like any restrictions? Bawal ba kumain ng matibigan?
not really, because you should just be careful and not to bite on anything hard on the front. Well, usually we ask the patient if we have veneers on to just slice your food and chew at the back. Yeah, but usually if it's just normal sandwich or meat, you can bite. Yeah, you can bite. Just be careful if there's a bone or yung bato sa kanin. Yeah, or yung tinik. Yeah, yung tinik, may bite.
Nangyari sa akin yan dati.
Talagang, akala mo crispy yung kanin, hindi pala.
Yung
May
pasta
bato.
nabasag dahil sa kung anong kinakain ko. Gabi pa naman.
Oo.
Wala akong mapuntahan dentist. Medyo challenging yung mga ganong
Oo.
cases.
So yun yung isa sa mga challenges when it comes to under the process of having the veneers, right?
So, matanong ko na lang din, Doc, since sa pag-uusapan natin ng veneers, ano yung pinaka-main benefit nito? Apart from being more on the aesthetic aspect, are there any other benefits of having veneers?
Well, if you want to change the color of your teeth, the shape, you can smile more confidently. Basically,
Okay.
Yeah, that's
Actually,
it.
yun yung main benefit dun eh. Like, you have to be very confident in
And for
yourself.
some, if you have like a large filling, for the longest time, you keep on replacing it. If you replace it with a dental veneer, then it would last longer. You wouldn't have to replace it from time to time. So which is more economical, yeah, and less hassle for you. Yeah.
Hindi ka pabalik-balik.
And babalikan ko lang din, partner, kasi
Ano?
napag-uusapan ka natin kanina, bigla pumasok sa isip ko, yung pagkain kanina, di ba? What are the other things that people who have veneers should consider? What are the do's and don'ts?
Do's and don'ts. Well, basically, do's is you have to keep it clean. Try to avoid having gingivitis. You always have to floss. Always have to brush, and then watch what you eat. Like, don't chew in front. And then do's is just, keep on doing what you're normally doing. Because you're just basically replacing the natural tooth with the porcelain.
Right. And matanong ko din, Doc, kasi nabanggit nyo kanina yung flossing. Medyo interested ako doon. Kailangan ba talaga nagpa-floss
Yes.
like every day?
Like every day or every after meal?
Ideally, well, if you can't do it every meal, then maybe before you go to sleep, after you brush, yeah.
Kasi pagkagabi, dapat na akong mag-brush.
Toothbrush na lang.
Because brushing alone, the bristles can't penetrate the in between the
totoo
teeth.
nga.
Exactly.
Yeah, so I see a lot of patients with cavities in between the teeth because they don't floss.
But wouldn't it
Yeah.
hurt yung gums? Kasi minsan kapag ka nagpa-floss, nagdudugo.
Well, if it's bleeding, then maybe you're
Hindi
you're
tama.
either doing it wrong, or your gums are inflamed, which you have,
Okay.
which means you have gingivitis. So if it's bleeding, then I would suggest
could
you go
either be,
for
yeah.
you go for cleaning.
I think if it's bleeding, di ba, it comes with pain then? Or wala ba? May mga ganun din.
Well, some patients they would feel a little bit pain, some not really.
mapapansin mo din
Yeah.
How about yung mouthwash? Okay lang ba na mag-mouthwash every day?
Wash.
Every after meal.
Well, for us, mouthwash is just for the fresh feeling.
lang, no?
Yeah, fresh feeling. But in terms of preventing gingivitis or cavities, I don't think it has much effect as compared to the proper brushing and flossing. Yeah, because with just mouthwash, you don't remove the plaque, which is the where the bacteria develops for the gingivitis and the cavity. Yeah.
Okay. Would yung tawag dito water floss, would that help?
Water floss.
Is that effective compared to halimbawa
I'm
you're
not
doing
so
the
sure.
actual floss?
I'm not so sure, but for me personally, I'd prefer doing the manual flossing, the string floss, yeah. Because I don't think the water floss can penetrate the tight contacts between the teeth. Yeah, so especially at the back, it's quite hard to maneuver the water floss to reach some areas. So yeah.
And actually, mahal din kasi yun, ano?
So, mas
mura
okay na yun. Mas
mura
flossy.
sinulit eh.
Oo.
Actually, bumili ako nun dati. Tapos, galing China. Hindi naman ako.
Tapos?
Nasira din agad
Nasira.
after ilang weeks. So,
Pero
yun.
sa tingin mo, parang okay naman, comfortable ka naman doing
Nag-enjoy
it.
naman ako. O, siguro dahil parang feeling ko may bagong gadget. But apart from that, parang okay naman siya. Nilalagyan ko ng what do you call this? Ng mouthwash. Hinahaluan ko. So, in water. But anyway, what are the other things that people should consider in taking care of their oral health?
Other things to consider, well, don't be scared to visit your dentist, and please don't wait for you to experience any pain or any infection before you go see your dentist, because we can prevent so much more.
Prevention is always better
The
than
expensive
cure.
treatments, we can avoid the expensive treatments if you just go for because for example, if you have like a caries or cavities on the enamel, you wouldn't feel any pain or any symptoms for that one. But if you feel a little bit of discomfort already, that means the cavity is quite deep already, which is reaching the dentin of the tooth. And if it goes beyond that one, if it reaches already the nerve, then the filling you can't do filling anymore. You would resort to root canal treatment. So
Or extraction.
extraction, yeah. So don't wait for the pain or any sensitivity before you go see the dentist. Yeah.
Pero dun sa mga may veneers na, Doc, how should they take care of it? And I mean, what are their responsibilities? Kasi may mga iba, di ba, na parang, nalagay na to. ang
Okay
ganda ng
na.
ngipin ko, okay
Nakalimutan
na to.
yung pag-maintain.
Yes, exactly. At ano yung mga responsibilidad nila?
Yeah. Because for some people, after we cement the veneers, they leave the office and they're like, then it's done.
Hindi na ba babalik? May mga ganyang mga cases din.
Hopefully, not. But for me,
Hindi na babalik.
personally, I tell my patients that please maintain cleanliness and please avoid, not flossing. Flossing is very, very important if you have veneers, because in between the margin of the tooth and the veneer, if food is collected there, the cement might leak, and it would start to discolor, start to break down, and then your veneer will not last as long. Yeah, so
And kailangan pa rin talaga pumunta sa dentista every 6 months.
Every
Hindi po
6
kasi
months.
bumunda na yung ngipin.
Diretso ka na, wala na.
Kakalimutan na si Doc, di ba?
Would you agree, Doc, na talagang pag nag-veneers ka, high maintenance talaga? Would you agree?
yeah, I would. It's better to think that it's high maintenance. If you don't think that it's not high, you wouldn't take care of it.
Yes.
You have to. You have to think of it as an investment because you paid quite a sum of money for
And you
that
don't
one.
throw
Yeah.
the receipt.
Yeah.
So you would be reminded every day how much it
Right.
cost
Yeah.
you.
So you have
And
to take.
speaking of the high maintenance and the costs that you have mentioned,
Yes.
how much does it usually cost
Range,
to have
range
veneers?
lang
A
naman.
Well, it
Kasi
depends.
sure na sure ako, ang dami nang nag-iisip.
Yeah.
Gusto ko
Nag-iisip din
magandang
ako.
ngipin. Ako din eh. Kaso gusto kong malaman muna magkano ba?
Oo.
Well, it depends on the case, especially how many teeth. Because some people, when they smile, you can see premolar to premolar, so that's around 8 or 10 units. But some people, they have a narrow smile, so it's just we do the K9 to K9, so 6 units.
Okay. So depende sa
So
case
depends
din talaga.
on the case, and it depends on what the patient would want after, like how much they want to change.
And
Partner,
depende rin kung anong klaseng gusto nila.
yes,
Kung
kung composite
porcelain
or, yeah. Doc, may tanong lang ako. Pwede ba ako magpapa-veneers dito lang sa upper?
Sa ngipin lang.
Pwede naman, di ba? Kasi when you smile, ito lang naman. Hindi ka naman hindi ka naman gagano.
Bakit anong gusto mo?
Upper lang. Upper.
Ganyan lang.
Anong gusto mo? Yung dalawa? Yung two front teeth?
Hindi naman. Dalawa talaga lang. Siguro yung mga 6 na sinasabi
Yeah,
niya.
in the 6. I have cases that I only did 2 because the patient has a space.
I see.
Yung gap na.
Yeah, may gap siya. So small yung centrals niya. So she wants to close
Pero
the...
bagay naman, yung dalawa lang.
we can match naman the shade.
Pero Doc, matanong ko lang pala. Sorry balikan natin yung dun sa procedure lang ng kaunti. Sabi nyo kasi, yung anong binanggit niya yung gap. Paano pag walang gap yung ngipin? Paano nilalagay yung veneers? Are you going to scrape off a part of the teeth so that you can...
So we prepare, we prepare just a minimum of 0.3 to 0.5 millimeters. Sometimes 0.7 depending on the need. So if you want to change the color, it might be big. We have to reduce a little bit more. But usually the range is 0.3 to 0.5 millimeters. And there are cases where they do no prep veneers. But me personally, I prefer with preparation so that the bonding of the veneer would be a lot better. Yeah.
Okay.
Doon tayo sa cost. Hinihintay ko,
Balikan
Doc.
ulit natin yung tanong.
Hinihintay ko,
The
Doc.
range.
Magkano nga ba?
Sa isang veneer lang
I
po
think that's
siguro.
per-
no? Or,
It depends.
set na yata.
Set na ba?
We usually charge it per tooth.
Oh, per tooth na.
So it depends on the case and how much do we want to change. Yeah, so like if you want to modify the color, if the patient wants translucency, additional characteristics for the veneers, then it would.
Yung parang hindi halata, ano?
Yeah.
Yung parang
Yung parang
normal,
natural lang.
natural teeth.
Some people, they want it natural look, like they don't want people to
Yes.
know that they have veneers. But some people, they want it to be noticeable that it's super white and this one
Ako
has
ha,
a veneer. So-
ayoko ng super white din kasi parang hindi siya natural
Normal.
tignan.
But some people, they flaunt it. Na, look, I have veneers.
totoo,
So.
veneers.
Kahit yung sa brace, di ba? May mga iba gusto nila, kitang-kita yung brace nila.
Every time pag selfie talagang labas yung ipin.
So,
di
sure
ba?
ka,
Oo.
sure ka kasi na pag naka-brace.
Kapag i-assess mo ba si Kenzo?
Ako? Baka mamaya pangangahin ako dito ni Doc. Huwag naman ganun.
Hindi, pag i-assess mo ba si Kenzo, kailangan niya ba ng veneers?
Yes. Ako na yun.
Oh, it's up to him. Yeah, he has good alignment, and then his lateral is a little
Ako
bit
daw.
small.
Yeah.
Yeah. So yeah, the alignment is good,
Kaya
but
talaga.
Humingi ng
some
free
teeth
consultation on air.
the levels. Yeah, we can make it ideal. Well, basically with veneers, we make the teeth look ideal.
Oh, yeah.
Yeah, so more symmetrical. The angles are depends on if you want a masculine look or a feminine look. More rounded angles. We look
Hindi
at.
natin natanong, after ba the procedure, Doc, may pain ba na nararamdaman? Like,
Well,
sensitivity?
during the procedure, we have anesthetics, so you'll be numb. But afterwards, you might feel a little bit of sensitivity or a little bit of discomfort since we did a little bit of preparation. But you can take painkillers, and we also put temporaries. Yeah, so you'd be comfortable. Yeah.
All right. Is there anything else that you would like to ask, partner?
Actually, yun lang.
So siguro before we close, I would just like to ask you, Doc, are there any final reminders that you would like to share with our viewers and listeners right now kung paano mapapahalagahan ang kanilang oral health?
Okay. Well, the common thing that I see a lot in my practice is usually common for Filipinos. What we call the abrasion of teeth. So abrasion of teeth, it happens if you're brushing too hard.
Okay.
Most of us, I think it's very common for Filipinos to brush very hard, and they use hard bristles of toothbrush. So what happens is you abrade the tooth, and in turn you would feel sensitivity. So I would suggest for people watching not to put too much pressure when you're brushing, because you're damaging your teeth already. So if you feel like you're not able to clean your teeth properly, I suggest you just go to the dentist, because we do the scaling for you to remove the hard deposits, and after that you just do the normal brushing. No need to put too much pressure because you're damaging the teeth. And just a reminder.
Yes,
That's the
and
common thing I see a lot.
And of course, pwede nilang bisitahin si Doc sa clinic. And lalong-lalo na sa Gulf Dental Center, very affordable din naman ang rates. I was actually just there a week ago. Nagpalinis lang naman.
So, hindi po pa naisipang magpa-veneers?
Baka next week. Wow.
Wow! Agad-agad.
Pag-ipunan muna natin,
Pag-ipunan
partner. Right now, Doc, is there anyone that you would like to acknowledge or thank?
Yeah, of course, I want to acknowledge our bosses for Gulf Dental Center, Mr. Muhammad and Dr. Mahmoud. And I would like to say hi to the people from Gulf Dental, Old Airport Branch. Hello, everyone.
Friends, families, baka may
Yeah, my friends and families who are listening.
Chinika. I mean, end of the month, right? Yeah.
Talaga, ikaw,
Ako yung chumika sa kanya. In behalf. Para machika niyo yung mga taga-Pinas.
baka mamaya hanapan siya ng pasal mo, kasalanan mo.
Kasalanan ko pa. Sige, Doc. Baka may gusto kang i-hi sa kanila.
So yun, once again, maraming salamat, Dr. Arman Miguel Yuson, for joining us here in the studio. On behalf of Kabayan Radio, I would also like to thank Gulf Dental Center for making this event or this episode of The Doctor Is In possible.
Indeed, mga kabayan. And of course, partner, it has been a pleasure to speak with an expert on how we can maintain our oral health. Talagang super importante para sa atin, especially sa mga wala talagang masyadong idea kung ano nga ba yung importance nito. And again, thank you for joining us here. The Doctor Is In, Doc. And sa lahat ng ating mga kababayang naka-tune in, sa mga nakapag-Facebook live sa atin ngayon, don't worry, meron po tayong replay doon mismo sa ating YouTube channel. Of course, after this one, pwede niyong ma-review.
Yes.
Okay?
Pwede niyong balik-balikan.
Yes.
At makita ulit si Doc.
Oo. At kami din. Sali mo naman tayo.
Hindi pa ba sila umalis?
Hindi pa ba? Anyway, this is Andi, mga kabayan, for The Doctor Is In.
And also, my name is Kenzo of Kabayan Radio 94.3. And as always, stay safe, keep smiling, and be blessed.
Thank you, Doc.
Thank you.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3. Have a brighter and wider smile with Gulf Dental Center. Gulf Dental Center is one of the biggest dental centers in Qatar that offers modern dental services with their cutting-edge technology and facilities. You are in safe hands from start to finish. Gulf Dental Center, where beautiful smiles are created for you and your family. For more inquiries, please call